devices I'm going to use, how do I translate that functional vision I have measured into something measurable and come up with the right low vision devices that I can use? That's one question. Then
1 minute, I can't hear clearly. There's a lag or there's some disturbance there.
Oh, okay, sorry about that. So I was asking about functional vision.
Better now.
Okay. So you mentioned for children who may not have gotten to a stage of us getting a measurable visual acuity where we have to use functional vision to measure. So I was asking, for example, a child who you use the hundreds and thousands to measure, how do we convert that value into something measurable when we want to come up with appropriate low vision devices?
Okay. You should not convert that because that's not correct. Because the entire purpose of functional vision assessment is to know, like I said, what is the level of the child's functioning, what the child can use the vision for, and then what can be, so these are the two basic purposes, right? What is the level of visual functioning of the child and what the child can use the vision for. So these hundreds and thousands are, so when I told about hundreds and thousands, this is for the near acuity for infants, basically infants, less than a year old or something. You can have this candy on your palm, so but it has to be colored. If you have white on white palm, it doesn't work. So the child can reach out for it. Because the child is seeing is only the reason they are reaching out for it, right? Because it is sweet. The moment they put it to their mouth, because it is sweet, they reach out for it. You know that the child is seeing that. So that is just a rough measure of whether the child is seeing or not. So similar for functional vision assessment. You can do a confrontation perimetry, for example, right? Again, you know the extent of the visual field the child is able to operate in. So things like that. So functional vision assessment itself means you're not going to be able to quantify that vision. It is only for qualitative purposes. So it's not correct to convert. Not to say 1 centimeter at 40, 1 centimeter object seeing at 40 centimeters, let's convert this to visual acuity. No, it doesn't work that way. It is not for that purpose.
All right, thank you very much. So the second question,